I call my local hospital first?
Yeah.
Would that be a place to start?
Hey!
Yeah,
How old are you?
14.
This is a 14-year-old patient that presented to us with Tourette's.
Hey!
Okay. So what are the tics that you experience?
I have a lot of neck twitches, as you can see. I usually just have to crack my neck. I have to keep flipping the hair out of my face because it touches my eyes and that just bugs me. Hey! I yell a lot. I have a few verbal tics. I have to say things. I haven't been doing those lately though. I've been really doing the necks twitches a lot lately. So.
Do you want to say
keep
anything?
doing. Keep explaining to the audience.
I have some kicking and hitting tics. I don't actually hit people, but I have to hit walls and stuff, mostly to give off pressure. I bump into stuff a lot. Sometimes I have to bang my knuckle off of something until it hurts. If it doesn't hurt, then I have to keep doing it. I have to, lately I've been doing I have to flex my bones and my muscles and stuff. Sometimes I have to like squint and make faces. Usually when I look in the mirror, I have to. Just because I have to see myself do it. I have to do it in a certain way. Otherwise I have to keep doing it. It has to be perfect or I have to keep doing it. It also really has to do with OCD, my Tourette's. That's pretty much why I have to get it perfect. So. Hey! Usually when I'm nervous and stuff, or if I have more attention, I do more tics. So. It doesn't matter if it's good attention or bad attention, so. I do have a lot of fun with Tourette sometimes. With friends, we just joke about it and stuff. It's fun being in an environment where kids can accept you for who you are. I was lucky to be in an environment like that.
But all the world's not that easy, right? You get cussed out a lot and looked at.
Yeah. I love acting and stuff, but I went to this theater in Spring Grove, and this girl actually came out and cussed me out because she was upset that I was ticking during the play. But I just explained to her I had Tourette's, and I went on with it. I try not to let that sort of thing bother me, so that I can just live on with my life happily. It's not good to focus on that sort of thing. I did have depression from Tourette's around 2007 because I used to let it hit me hard, so just stopped focusing on that. So.
Okay.
We're going to do the best we can for this young boy. Fortunately, he's understands his problem because he has a IQ of 128. These patients are not low IQ children. They're very, very smart, trapped in this disease, and this is what the dental profession should be doing to help these children out all the time. This young man is getting his lower appliance today. We just put it in a few moments ago. And you can see it has caused a diminution of his facial tics and his vocal tics and so on, although they're still not completely gone. They will go away over the next couple of days. You can see that it's barely noticeable in his mouth. Actually, this is a repositioning TMJ appliance because he has bilateral reducing disc displacements in his jaw. I believe underlying all these Tourette's patients, at least every single one that I've ever seen, they all have an underlying internally deranged temporomandibular joint, which has been totally missed by the Tourette's community because they've misdiagnosed all these cases because they have not evaluated them from a TMJ perspective, nor have they taken TMJ imaging studies, particularly MRIs. Open. This is what it looks like. You can see that it's got a highly indexed occlusal spaces for his upper occlusion. It's got these ailerons on it to elevate his tongue. That opens up his throat. One of the first things the patient notices is that their breathing increases. Tests show their oxygenation and the oxygen level of their blood rises when they wear this in because their throat opens, their epiglottis moves forward, their tongue position changes, etc. And this just gets placed on his lower back teeth and is held in place by these clips, and the patient just puts it in and it clips on his teeth, and then he just bites into it, open wide. The best thing to do is initially open wide and then close down into it, bite like that, and that's all there is to it. And that sets his jaw in the correct maxillomandibular relationship to the base of his skull, decompressing the tissues of his temporomandibular joints at the skull base. Say Monday, Tuesday, Wednesday, something in that order, if you can make it back. Okay? Once it's been in, can you make any or discern any differences in your breathing? That's usually the first thing, the breathing, the decrease in any urges to tick or just speak to the audience.
Well, I have this foot tick where I have to crack my ankle all the time, like every time I walk, every time I sit, and since I've had this brace in, I haven't done it nearly more than twice, and that's really awesome. I have barely done my neck twitches, and they've been hurting a lot lately because I've been doing them so much. But with the breathing, I actually thought my breathing was normal like everyone else, but when this thing was put into me, I just felt like clear, like I was breathing air for the first time, and I just felt so good in my throat, like it wasn't clogged or anything. It just feels open. It's really awesome.
Okay, good. This is the patient as he returns 6 days later. He's been wearing this about half time during the past 6 days because his time has been preoccupied with a school play in which he has been participating in it. But now he's promises me he is going to be wearing it 24/7 for the following 2 weeks. What I've done is in the past 3 or 4 minutes rebalanced the occlusion so he's hitting evenly on both sides, and his jaw is repositioned so his lower jaw is advanced and his incisors meet edge to edge. Zero in on it. This is his occlusion right now. Open wide. This is the appliance in his mouth, and it's highly indexed. Bite. Now see, and he goes right into the indexing, and this moves the mandible forward, taking the pressure off his temporomandibular joints and reducing the recurrent dislocations. So just look into the camera and let them see your face. Do you want to mention any benefits or non-benefits you've received over the past 6 days?
Well, actually, I got a lot of benefits. Right away, I actually I stopped doing ticks a lot, and lately I haven't done them at all. But I did take my brace off one time, and I actually had a tick explosion where I was going nuts. I think that happened because I took the brace off. So that was the downfall part. But I think this brace really works.
You had 58 ticks originally. Didn't we just establish that at your initial appointment?
Yeah.
Okay. Okay. Let us see you in 3 weeks, and but I really want you to wear it faithfully. Okay.
Okay.
Good. This is my buddy Jesse. We gave him this lower appliance. Let's see, a month ago, and he wore it for a couple of weeks, and then he lost it, and he came back, and we took an impression a few days ago, and so he's been without the appliance for how long would you say now? A week or 10 days?
Yeah.
Something like that. Okay, and then we're going to deliver him a second appliance in a few minutes, and so we just want him to tell the audience what happened while he had the appliance, and what happened after he lost it, and how he feels now. So look at the camera and tell the audience how you were doing before and after you lost it.
Hey! Well, when I had the appliance, I was really calm and I didn't do tics nearly as much. In fact, I kind of forgot I had Tourette's more than I usually do. With school and stuff, I just was barely ever doing it. I took the appliance off for about 4 days, and I actually had a tic explosion, and where I was going nuts with Tourette's, and then I put it back in like the next day, and I was all calm again. So it was like, and nothing happened. I feel really good with it, and it's just like like I said, I don't notice I have Tourette's when I have it, not as much. When I lost it, I was really bummed because I lost it, because it was like really my only way to get out of it, and I kind of felt like I was more hyper, like afterwards, and that I sort of kept getting off track. I couldn't stay focused anymore in school, and actually I did really bad on my last 2 tests, and I'm not turning in homework, and because I can't stay focused. But when I had my brace, I could always stay focused.
I am letting the camera run so that the viewer can observe these tics that have returned, particularly his foot tics and his head and neck tics, as well as his vocal tics. Had he worn the appliance for 2 or 3 months steadily, these tics would have not returned. For the professional viewer, please keep in mind that I have only seen one patient that did not have an underlying internal derangement of the temporomandibular joint as a cause of these tics. Please keep in mind that there are 3 types of internal derangements, not 2, that occur in the temporomandibular joints. In addition to the click and the locked joints, there are ones in which the disc is in proper relationship to the condyle, but both the disc and the condyle complex are in malrelationship to the posterior slope of the eminence. That was the one exception that I have encountered over the years in treating these patients. The reason you are seeing more boys than girls with this affliction is that studies show that Tourette's is 5 to 6 times more common in young males than it is in young females. And it usually begins at 7 to 8 years of age and increases as these children go into the teenage years. Some of them outgrow it, but a lot of them do not outgrow it. We have treated these patients in their 30s and 40s, but the bulk of them are in their teenage years, from 14 to maybe 22 or 24 years of age.
Bill, man! That kind of hurt. Hey. Yeah, I know.
Okay, your thing's is hardening up. We modify.
It's starting to get kind of hot in here.
Huh?
Is it hot in here, or?
Not particularly, but he's probably is. Okay, as soon as it gets hard, I'll bring it right in.
Alright. I'm starting to get really tired. I'm starting to sweat. Wow, dude, why am I doing this?
I have just inserted the appliance and am inserting articulating paper to adjust the bite. You will notice that he identifies the right side of the appliance as being too high several times. I then lower the right side. It must be balanced. The appliance must be balanced so he hits both sides when he occludes simultaneously in time and with pressure. One side cannot be higher than the other. He identifies the right side as being too high 2 or 3 times. You will notice that once the appliance has been balanced perfectly, his symptoms immediately cease. Okay, the appliance has just been delivered now, and it's been sitting in the patient's mouth for approximately 5 minutes. And you can see how his activities have more or less decreased greatly. And as he wears this, they will decrease and stay decreased for longer and longer intervals. There might be a few instances where they break through to the surface, but those instances will be fewer and fewer. In the 5 minutes time that the patient has been sitting here, he and I have had a heart-to-heart talk about wearing this full time. And he must wear it constantly when he eats, kisses all the pretty girls in high school, talks and gives reports in class, etc. He has to function with it 24/7, or else it won't do him any good, and he will only be a partially treated Tourette's patient. And that's not good enough for me or for him. You have anything you want to say to the audience? Like you're on TV?
I'm going to take better care of it, and I'm going to wear it all the time, starting now.
Okay, good.
And I just do want to say, I really do feel different right now. And it really does make a big difference.
This is Jesse as he returns 6 weeks later. And what we've done is convert his intraoral orthotic from a pivot appliance to a repositioning appliance, where we have lowered the height of his appliance and indexed it so he is now biting with his mandible in a forward position here. This further decompresses the tissues of his temporomandibular joint. Okay, pin him. You can see him here. Look in the camera here, and say something to the viewing audience here. How you've been doing in the last 6 weeks? You've been in a school play.
I've been in a school play and a band concert.
Okay, don't look at me. Look at that.
Oh, sorry.
Okay.
And I've actually gotten to the point where it's working so well, I kind of forget it's in my mouth and it's just there. It's already it's part of a normal day routine with it now. And a lot of my tics I've noticed have kind of drifted away to the point where they mostly never come up. I haven't gotten mad at all since I've gotten this piece in, to the point where I've yelled at someone. I haven't yelled at anybody in a long time now. I haven't been emotionally overbearing at all in any state. And I have a clear mind every time I have it in, that I can think about my work and get it done. And my grade's been going up. So.
I'd like to introduce you to Jesse's father here, who has accompanied him, and to say a few words. Come on in here.
Yeah, Jesse's teachers have reported back to us that his tics are significantly less during class time. His focus is better, and we've definitely felt around the house that Jesse's ticking less and that he's more peaceful. There's some kind of emotional connection here too, where just not ticking so much has helped him to relax in a lot of areas. But he was yelling certain words 2 to 3 times a minute, and now we can go an hour and not hear it at all.